Researchers are looking at erythritol for their health implications, and they've discovered that erythritol can significantly increase the risk of heart attack and stroke. Now, that's actually a big statement to make, but it's a big finding. And the study that's been looking at this that I want to talk about is coming from Cleveland Clinic's Lerner Institute. And in the study, the researchers gave healthy volunteers erythritol in the amounts that you would typically find in a sugar-free drink or snack. And here's what they found. That when they gave the subject erythritol, same amount that you'd get in a drink or a snack, boom, you ate it, the blood levels of erythritol spiked 1,000-fold as high as from the beginning. So this is a substance that when you eat it, gets right into your bloodstream. And if it gets into your bloodstream, some of you may have heard me talk about this, our bodies contain 60,000 miles worth of blood vessels, and these are the highways and byways of health, and they bring everything that we eat or drink, and including the things that are not so good for us, in this case erythritol, they'll deliver to every single organ and every single cell in the body. 1,000 times spike, all right? And what was concerning in these human subjects is that while the erythritol was in their body, their blood platelets, now these are tiny little cell-like particles that are in our blood, their platelet activity, meaning the platelets got activated significantly. Platelets are basically cell fragments that are naturally found in our blood. So when you donate blood, there's platelets in there. And the natural job of the platelet is to help form blood clots when you're injured. When you have any kind of injury, right? Cut yourself in the kitchen with a kitchen knife, scrape your knee, falling off a bike or whatever, okay? You get some bleeding. And the reason the bleeding stops is because the platelets race to the scene, and they become activated, and that activated platelet begins to form a clot, right? So activated platelets form clots. People who ate a lot of erythritol, but a lot meaning what you get in a normal snack, actually had activation of their platelets. Now, to me, that is a red flag that gets immediately sent up. Now, when the platelets become too active, as in this case, like erythritol cause, all right, what happens is that the platelets that wouldn't normally clot start to form little clots in the body. Just what you don't want. This is dangerous because if you wind up actually triggering blood clotting, you can actually interfere with blood flow to the organs when the clot forms in the blood vessels that are trying to feed organs, your oxygen and nutrients through your blood.